In this series of career sessions, all of our guests hold doctorates in their chosen field, and we invite them to talk about their pathway from PhD candidate to present day.
We ask them what they've learned, and we also ask them to give advice to people who might be thinking about a career in research when they've finished school or when they've finished their undergraduate degree.
Welcome to Career Sessions with your hosts, Steph and Tamara. Proudly sponsored by Inspiring South Australia.
Today we're talking to Associate Professor Matthew Leach, who graduated with his PhD in the School of Nursing and Midwifery at the University of South Australia in 2005, following the completion of his thesis titled The Clinical Efficacy and Feasibility of Using Horse Chestnut Seed Extract in the Treatment of Venous Leg Ulceration. His program of research is underpinned by three pillars of health: the consumers, the provision of care, and the impact of that care. He held the position of Senior Research Fellow at UniSA for many years, and in 2014 he was awarded a research fellowship at the Australian Research Centre for Complementary and Integrative Medicine, an honorary visiting fellow with the Faculty of Health at the University of Technology in Sydney. He is an accomplished author and speaker, and he is very passionate about scientific rigour in complementary medicine research. These days you'll find him at his new digs at Southern Cross University, Lismore. And welcome, Matthew.
Thank you for having me.
Thank you, Tamara. So just to set the scene a little, to put this all into context, what are you doing right now? So what's your current role? What does your everyday life look like right now?
Apart from talking with you guys.
Apart from this, before this.
So I've only been in my new position probably for about 4 months now. So I had to move interstate, new university, brand new centre, $10 million centre, and was pretty much the first person there, and then the team's gradually built from that. So my primary role there is as Deputy Director of Education. So in addition to my program of research, I also oversee the development of brand new programs, not just in naturopathic medicine, but also integrative medicine, lifestyle medicine, planetary health. So it's quite a broad remit. And I guess the underlying philosophy of the centre is that as long as it has an alignment with naturopathic philosophy, then it's appropriate.
So you spend a lot of time sitting at a desk staring at a screen?
I do at the moment, a lot of Zoom.
Yep.
So at the moment you're actually in Adelaide?
I am. So when they started closing the borders, we made the decision everyone would just go home for that time. So we don't know when the borders actually reopen. So I'm just staying here in very cold Adelaide.
This is a great way to start a job. You're not even on site.
I know. Yeah. From like 30 degrees down to like 2 degrees.
Yeah. So let's go back to the very beginning. So are you a first generation university student in your family, or did your parents go to university? Or?
First generation. Yep.
Mm-hmm. And brothers and sisters, did they go to uni?
No, I was the first one within the nuclear family. And then interestingly, my mother followed suit probably about a decade after that. So I led the way, I think.
You led the way. And so what did you know what you wanted to do when you left high school? Or?
I kind of had two options. One was I was looking at teaching, or one was looking at in a health kind of area. And I lived in Whyalla, so it's a regional town, about 20,000 people, and they had a university there, and the only health option there was nursing. And so I'll just do that. I wanted to do a degree. I wanted to get into health, so I'd studied that. When I graduated from that and did into my internship, I started to realise there was something still missing from what I wanted in my clinical practice. At that time, I was talking to a colleague who was studying naturopathy, and the philosophy of naturopathy kind of resonated with me around the ideas of holism, treating the underlying cause, using innate healing ability of the body and so forth. And then I went off and studied naturopathy on that, but then something again was missing from that, and that was probably what drew me to nursing. That was the scientific evidence base behind that. And so I thought my mission then was to look at building an evidence base for naturopathic medicine.
Well, you really had a plan.
I did, but I didn't have kind of, it wasn't foreseen though, it's kind of just happened as
Or was it like at
along.
age 7 you knew exactly?
No, I had these little epiphanies as you go along.
Yeah.
But, yeah.
So did you go to university straight from school?
I did, yes, straight away. Yep. I was very keen to be at university because I wanted to, I saw myself probably in a leadership role I'd like to be in the long term. I thought university was kind of a pathway into that.
And so it was no slip of the pen or anything that got you into a nursing degree. It was very much a decision that you made that you wanted to be in health, although I suppose you were limited by your regional status.
That's right. Yep.
So your undergraduate degree was nursing.
Yep.
What did you do after you finished nursing? And into not naturopathy, did you do an honours degree? Did you do a master's degree? Where did you go next?
So after naturopathy, as I mentioned before, I wanted to build the evidence base for NatMed. And so at that time, I realised if I wanted to do that with some appropriate credentials and have some credibility in the field, I needed to build some research credentials behind that. So I studied my honours at the time, which was kind of the fast track into a PhD. I wasn't quite sure what I wanted to do at that point in time. And that honours was really merging nursing and naturopathic medicine together. And then I kind of got the taste for research and thought, I want to take this further.
Yeah.
And at that time, they were offering scholarships. So I went off and did my PhD. And again, that was merging nursing and naturopathic medicine together. And then got a real taste for research and academia. And that's kind of, I furthered my path in that area.
So was it straight after honours that you had realised that you wanted to do a PhD, or did you have a few years out? Or
No, it's kind of like just back to back. School, nursing, naturopathy, honours, PhD. So there was no gap.
So how old were you when you graduated?
My
PhD.
Oh God, I don't know. That would have been mid-20s.
Wow.
I think. I don't know. It's gone back a while.
So you knew you were interested in research and you knew the field that you were interested in researching in. Did you know then what your topic was going to be for your PhD, or was that related to the funding that you got?
It's kind of, I think, around the time we finished our honours, they had the call out for PhDs and they said, put forward a project idea that you'd like. And I originally thought of a different topic altogether. And interestingly, the research degree coordinator at the time tried to sway me away from that topic, saying, no, I don't think the methodology is right. I don't think the question's right. Because I was looking at doing a clinical trial and the school said, we don't really have support for people doing clinical trials. So we sway you maybe to do some qualitative research instead.
Well, that's quite different from a clinical trial.
It was. And me being, I guess, a quant person, a numbers person, didn't really align with my kind of underlying passion either. And so I kind of convinced the research degree coordinator that, no, I really want to do a clinical trial and it has to be in venous leg ulcers. It was originally going to be essential oils at that time, but then I changed my topic halfway through and looked at a herbal medicine.
Halfway through your PhD?
No.
Okay, we're going to unpack that a little bit.
Yeah. What made you change your treatment?
I think when I went into it originally, I went into it with a nursing headset, a biomedicine headset. And I was like, how can I treat this like a drug? Just treat the symptom. And that is try and reduce the microbial load of the wound. And hopefully that would then in turn improve wound healing. But then at that time, I was conflicting with my naturopathic philosophy was that actually we need to treat the underlying cause. Mm-hmm. The underlying cause of venous leg ulceration is venous insufficiency. So I had to actually address the venous system and not the wound directly itself. Mm-hmm. So that's why, to align better, I guess, with my philosophy of health, I completely changed the intervention to do that.
So what was the question that you wanted to answer with your PhD?
It was originally just going to be a clinical trial looking at the clinical effectiveness of horse chestnut seed extract for venous leg ulceration.
And so you'd have like a control and a...
Yeah, so the active group, a matching placebo, they had the intervention taken orally for 12 weeks in conjunction with wound management provided by the nursing staff in the community. But as you know, there was a challenge in recruiting people for clinical trials.
Yeah.
Yes.
A major challenge. I didn't quite get the sample size that I needed. So I had a discussion with my supervisors and we thought, okay, we need to actually beef up the PhD. So maybe look at beyond effectiveness and look at a whole range of other things that look at maybe more feasibility of this as an intervention. So it essentially became probably one of the first mixed methods research studies that I guess at the time was not really a methodology. Mm-hmm. So it started off with the clinical trial, then it became a survey of actually saying to consumers, medical practitioners, nurses, would you use it? Mm-hmm. Why wouldn't you use it? Why would you use it? What would facilitate your uptake of it? So we're looking at kind of translation of the evidence. And the other one's looking at cost benefit. So actually just having the addition of this intervention actually have a cost benefit for patients and for the institution as well.
So what did you get out of your, what did we all get out of your PhD?
What did we all get? I guess it's certainly addressed a major knowledge gap in the field. And I think for venous leg ulceration, it's one of the most chronic long-term health conditions, skin conditions internationally. And I guess with that, I mean, I saw patients in the trial who'd had an active leg ulcer for 30, 40 years. It had never healed in that whole time. And these are not looked like small little tiny wounds. They're like, encompassing half the leg, lower leg.
Yeah, having a huge impact on their quality of life, I'm sure.
Absolutely.
Yeah.
And so for these people, the mainstay of treatment was to have multi-layer bandaging. These were compression bandages as well. So in the middle of summer, having 4 layers of bandages on their legs. And that caused dryness, irritation, discomfort, just the heat of the whole thing. And so compliance with that therapy was pretty low. And so I provided, I guess, an option to maybe look at another alternative that might be used either in conjunction with it or instead of, for people who actually couldn't tolerate that bandaging system.
So venous leg ulcer is not the ulcer that you get from lying in bed for long periods of time?
No, that's more pressure ulceration. So it's more so an underlying problem with the venous system. So it might be from prolonged standing, often associated, linked with varicose veins initially. So preventions where you're standing up for long periods of time, pregnancy and so forth.
Okay.
So you looked at the whole of a very broad scale project, looking at underlying factors, the symptoms, the feasibility of interventions, the economic value of interventions. So you had a whole package to deliver at the end of your PhD. So
Absolutely.
Certainly some value there. Would you say that pivot halfway through your project to widen your scope was the most challenging part of your PhD?
I guess it did push back my time frame a fair bit, because I think at that time I was tracking really, really well, but the project itself wasn't resonating with me. And I thought, and I think with a PhD, there are times where you will hate it. As you know, there'll be times where you just want to just throw it away. It's hard work. And the thing, I guess, the message that I've always told myself and certainly my students is, if you want to stick with something, you have to be passionate about it. If not, and I guess that's the problem I challenge with projects that are given to students, because often it doesn't resonate with them in terms of an area of passion. That is often looking at the end point, that being the parchment or the title, but actually not about the journey. So I guess my key message from that is that you have to be absolutely passionate about it, because it'll be those times that you fall to the ground where you just want to give it up, you can't stand it anymore, and that passion will keep you motivated.
So how long did it take you to complete your project?
I think with that delay in change of project to about 3.5 years.
Wow, that's great.
Yeah, it's actually pretty good. Mine goes longer than that.
Yeah. And how was the data collection? Like, we know recruitment is huge, and did that make the time any longer, or did you kind of have a set time and you just recruited within that time frame no matter how many you got?
That I had to extend that a fair bit, because the numbers were quite slow. And at that time, I had a lot of people who were gatekeeping and preventing people accessing the trial.
So in the hospitals?
So we had a process where at that time, we had to get consent from the person's GP or their specialist. Not so much now. That's not so much an issue, but at that time, the ethics were a bit dubious around the whole process, weren't quite familiar with clinical trials, and were being overly cautious. And so they said, I want you to have every single person that comes in with an expression of interest is have a GP sign off or a dermatologist sign off.
Just adds a layer of complication.
It did. And I think the biggest barrier to uptake was GP or medico refusal.
Because they didn't take it seriously, or they didn't have the time or investment?
One, they didn't understand the treatment. Two, there was definitely a bias against herbal medicine. A lot of them saying it was witchcraft.
Still is.
And there still is, absolutely. Yeah. And a lot of it was that they believed from what they read that there was a safety risk. And the thing is, the horse chestnut seed is safe, the leaf isn't. And we were using the seed, but they were reading stuff about the leaf and saying
they came in with preconceived ideas that they weren't willing to shed. Yeah.
And so as a PhD student, where you're still a student, you're still early in your career, that's quite challenging, being faced by people saying, no, this is not good enough. This is not a good trial. You're not a good researcher by virtue of that. So it was challenging. I mean, but it makes you grow, and it just highlights, I guess, the challenges of doing a clinical trial or any piece of research. or the PhD altogether.
Yes, you just added layers of complexity to yours by the topic area as well. So you're a challenging PhD plus being a controversial area.
Yeah.
Absolutely. Yep.
So how did you keep on going then if you had coming up against these challenges and it feels like, having done an RCT myself, it feels like it's there's a different challenge every day. So how do you keep going? How did you keep going?
I think passion was definitely the one. I think the right that I had in terms of being able to choose my topic and stay with my topic and even modify my topic, that was kind of what kept me going, because I had to take ownership then. I chose this topic, I need to see it through. But also I think, the supervisors were quite nurturing as well, and that's really important, because I think there are times where you feel really low and think, I'm a failure, this is not good enough. But then you had your supervisor providing a bit of a reality check.
Yes, research is hard.
Absolutely. Yeah. And also realising that the results aren't necessarily the end game for a PhD. It's about the process.
Yep.
It's also learning.
So it's about a research training program, not about a Nobel Peace Prize.
And you're not going to change the world with your one little project.
Exactly. No matter how much.
I do remember you saying that to me.
That's right. And how much you ignore your supervisor and think, I'm going to be that one.
I'm going to be the one that's going to change the world.
That's right.
So you were able to pick your supervisors?
No. So when I started, because there was no one else in the whole school who had any clinical trial experience, there was one that had a little bit of experience, and by default, they had to be the principal supervisor. And
you really did set yourself up for problems, didn't you?
I did. So I kind of started at times doing mixed methods where mixed methods didn't exist, into an institution where they didn't have any experience with doing clinical trials. So it was a barrier.
Yeah, on a topic that people didn't accept.
I know. I just love those roadblocks the whole entire way. But I guess adding to that, I also had my co-supervisors changed every year.
Oh.
And so my first year, it was a person who was in a senior position. They were more qualitative. Again, they didn't have any clinical trial experience, because most of the people in the school didn't have RCT experience. And then after the first year, she thought, I don't think it's a good alignment, my expertise with your project. And so she handed me over to another person who had extensive expertise in clinical trials. And then he came in for the second year, and then something happened, and he had to leave the institution and didn't want to continue with his PhD candidates, and so had to find someone else who had expertise around economic evaluation and so forth. So that was my final year.
That is actually difficult. Another challenge.
Another challenge.
Because your relationship with your supervisor is is a foundation of your whole experience, really.
Absolutely. I mean, you don't really want to say it's make or break, but it can make all the difference.
It can make all the difference.
Oh, absolutely, because they're your guide throughout the entire process, and they're reality check. Because there'll be times where you can often just go on a complete divergent and getting really excited about something, and they'll draw you back. So actually, that's not important at this point in time.
Eyes on the prize.
Absolutely. Yeah.
Based on your experience as a student and your role as a supervisor, how would you describe the life of a PhD student?
Oh, that's an interesting one. I think every journey is different. I have been a research degree coordinator for about 4 years, and so I've seen the other side of it as well in terms of the administrator side, but also seeing different people's journeys and different experiences with different types of supervisor setups. I think the absolute key for a successful PhD, one is about the passion. So be absolutely driven, and they should all know what your end goal is as well, not just the PhD, but what you want to do beyond the PhD, and how does it prepare you for that pathway. And the other thing is, I think you can probably do this probably more so now than previously, is choose the right supervisors, because you'll be with them for the entire that process, whether it be 3, 6, 8 years. And so don't be afraid, do a bit of personality check. Are they a good alignment with my personality? Are they kind of aligned with my interests? Are they thinking beyond just a successful completion? Are they thinking about my career? Are they providing opportunities for me to either do some teaching or to be part of grants or be part of papers as well?
Yeah, so it's more than just that one product that you create, the PhD thesis. It's
absolutely
all of the experiences you get along the way.
Yep.
Yeah.
Every good relationship, PhD supervisor relationship, should be actually a longer term relationship
than just
a longer
PhD.
term, friendship and
absolutely,
mentor.
Yep.
So, how did you get to where you are now? Like, what was your path?
My pathway. So I guess certainly I think the thing about the PhD is it opens doors. it unlocks doors,
Yeah.
doesn't necessarily open them. But I think for me, the PhD provided, I guess, access to academia. And academia provided, I guess, opportunities for developing pedagogy, experience in teaching, in research, and understanding administrative processes around education and research. And then I think building on from that, research provide opportunities then to access funding schemes, to attend conferences, to write papers, to build a track record in the field. And then collectively, all those things, the education, the research, the engagement, then provide you with a pathway for moving forward. And I think all those elements there create the pathway to where I am now.
So you stayed in the university system after you finished your PhD?
I did practice nursing for about 13 years. So I continued that for probably 1 or 2 years after my PhD. Partly because I like the term, having the term doctor while you're a nurse.
Dr. Nurse.
That was kind of an interesting terminology. But also there was, I guess, a level of respect amongst your peers that you've taken it to the next level, and you often challenge a lot of things in practice. But I felt that in clinical practice, there was something not quite there for me. Kind of another element for me was, I think the research component was probably missing in clinical practice. So that's why I got driven then to go into academia.
Yeah. So because a lot of academics don't actually have a clinical background. Even academics in health fields don't necessarily have clinical backgrounds. Has that made a difference for you in being an academic?
I think in terms of the education side of things, I think there's a level of respect from students that you've got a clinical experience. They kind of believe, okay, you've been there, you've experienced that. We can take what you say as a bit more than something you've read in a paper. You've actually lived that experience, and they kind of value that. But also I think the clinical experience also something you can then translate into research and look at so the biggest thing I think at the moment around research is not just doing research, but also translating that and implementing that into practice. I think coming from a clinician's perspective, you can understand that translational aspect rather than just stopping at, okay, I published my paper, I'm moving on to the next project. It's about, okay, I published the paper, how to get those findings into practice and how I can start changing practice to improve patient outcomes.
And so you're a bit of a machine when it comes to publishing. Did you publish out of your thesis, or was your thesis by publication or?
No, so at the time, there's no such thing as a PhD containing publications. I think there was probably one colleague who had just started that, probably one of the first one, the institution who'd done that. And he experienced major challenges around, this is not a PhD, what are you doing here?
If you haven't written 80,000 words on a single topic, is it really a PhD?
And then trying to find examiners who actually supported that as well. So at that time, I guess I had supervisors who were very traditionally focused, and they were thinking around, I'm just going to support you in creating a thesis, a traditional thesis containing chapters. But I knew for me that a thesis itself is often just a glorified doorstop. Very few
but a very impressive one.
Well, it's a fantastic piece of work and great to show your parents, but very few people.
This is what I've been doing for the past 4 years.
That's right. It's your first book, I guess, but most people don't actually read a thesis unless you're maybe another PhD candidate wanting to look at a lot of detailed information.
Yeah, absolutely. It can just be trapped then behind in that binder,
just holding
on
the
a
door.
shelf.
It's got that gold sparkly writing on it.
3.5 years of your life summarised.
It's great when the TV crew come out and you pretend you're reading something because it would be impressive.
It's your thesis.
I just happen to have this out.
That's right.
It's my coffee table book.
That's right. But I think that in terms of it having an impact, I had to then translate that into stuff that the public would see. And so at that time, I was really driven to getting into academia. And so I knew that to be an academic, I had to have a track record. And part of that track record was having publications. And my supervisors didn't really push me in terms of, let's get some publications out there. It's pretty much just focus on your thesis and get that done. So I, in my own time, I did the thesis, the normal thesis, but also added to that, creating 5 publications simultaneously at the same time to say, I want a track record when I finish this. And I managed to get them all done, and even I think finished my last paper, I think about 10 years after my PhD. So it doesn't matter even if it's during your PhD or just after your PhD, but even way after your PhD.
That's encouraging.
It's still valuable data.
Absolutely. Yeah, absolutely. Yeah.
So did you enjoy your experience, your PhD experience?
Yes and no. I think the thing about the PhD, which you'd never ever have again, is the opportunity to spend that entire period of time, that 3 to 4 years, focusing on one project that you absolutely
You just
love.
wallow.
Absolutely.
You can't do that out in the
No,
real
you
world.
No, that's right. And I think the thing that I really miss is the time where you actually, you know all the literature. You know every single paper that's been published in that field, and you are the expert in that field.
Yeah.
But then as you graduate, you're doing more and more pieces of research, write more and more papers. You can't look at those in the same level of detail you did in the PhD. So I do miss that level of immersion you get from that.
Yeah, just do another PhD.
Is the job you have now the job that you thought you would have when you were doing your PhD?
Oh, well, interesting. When I first went into academia, they did have a naturopathic program at the university, only for a couple of years.
At Uni SA?
Yeah.
Yep.
And at that time, that's kind of, I saw there was opportunity then to potentially grow in that particular area, build a really big program, and then become a leader in that particular field. But then that kind of program then dissolved for a number of reasons. And then I was kind of stuck into doing other sort of nursing, allied health kind of pieces of education and research. And so I never thought there would ever, because there was a time as well happening over years and years that many of the programs that were available in universities were gradually being dissolved as well and moving back to the private sector. So for me, I never saw there'd be a role for me, a senior position in naturopathic medicine ever in academia. So when this opened up last year, I was like, wow, this is a perfect opportunity.
Yeah, is this like a turning point for academia? Do you think that this is now your field is taking more seriously?
I don't know if it's taken seriously yet. I guess that's part of our role. I guess as leaders in the field is to shift that.
Yeah.
I guess certainly for me when I had that epiphany around I want to build the evidence-based practice, so the evidence base for naturopathic medicine, that mission still stands.
Yeah.
And my mission.
And this is the way to do it in academia,
Absolutely,
where people respect the answers you come up with.
And you're seen as being much more objective and critical rather than just being conformist. And so there was a level of respect being, I guess, in that position where you are, but also being able to shape education in the field. So I guess the directive I'm putting into my programs is it has to have a very strong element around evidence-based practice, around critical thinking, reflective thinking, clinical reasoning, not just doing, but actually thinking and acting appropriately.
So if you hadn't done your PhD, what do you think you'd be doing?
I guess, if the PhD, I think, was the pivot point for me to get into academia. I guess there are other ways to get into academia. I probably would have done clinical practice a bit longer, maybe not been as happy, maybe have regretted that. I could have got into academia, but the thing with academia is that unless you have a PhD, you can't climb the ladder. You're often stuck at a level A position for that.
So you maybe couldn't be where you are today without
Absolutely.
it.
So I'd be either stuck in clinical practice, which is not a bad thing, I think, but didn't quite meet my needs, or start at maybe a lower level in academia as well. So again, wouldn't have been completely satisfied in terms of having that leadership role.
And the leadership role is going to open up those opportunities for you to actually have an impact and collect the evidence, but more than that, put it out there, make sure people are hearing it, that it makes a difference.
Absolutely, yep.
So what is a PhD to you?
A PhD, I think, the thing I always tell pretty much students and new applicants is that think of it as a research training program. Don't think of it as a degree or an award. I think people often think of the actual project itself as being the PhD. It's about the whole entire journey. Obviously the thesis is a critical part of that because that's what you actually get examined on. But it's that what experiences can you capture during that journey? So it's about how do I write critically and academically that will be accepted by my peers internationally? How do I problem solve? How do I become a critical thinker? How do I work collaboratively? So with my supervisors and other people, how do I act ethically? How can I look at all information I'm exposed to, not just within an academic or research sense, but also way beyond academia, but also in the real world? How can I think critically and act critically around things that I do?
So your field is emerging. And how do you think the universities could go about better promoting what it is that you do in your field to help people understand that the purpose of your research and the value of it?
I mean, I think you mentioned at the start, my area of research is in health services research, and that's quite deliberate. I've used that terminology because a lot of my research is principally in complementary medicine, naturopathic medicine, but because there is, I guess, those names are tainted in some respect. There are biases associated with that. I had to make the decision to say, okay, what is a more appropriate terminology that captures my area of research, my focus of education, that's probably more accepted.
Not quite so weighed down with preconceptions.
Absolutely. Yeah. So I've kind of pitched myself in that area, and that's how, certainly when I apply for the position, I pitch myself in that particular space. Because I guess that's, you kind of push all those biases aside. I come in with, forget those preconceptions. This is my vision, my scope of practice. And then through that avenues of health service research, through evidence-based practice, then driving change in complementary medicine and naturopathic medicine as well. So it's almost like acting in stealth, really, until you've created that solid evidence base. So, okay, actually the truth's
like,
out.
Surprise, guys, we're actually talking about this field that you guys wouldn't accept.
Yeah, ninja cam.
That's right.
So if you're talking to people who are about to finish their degree, and they're contemplating a PhD, is now a good time to be doing a PhD, do you think? Or what advice do you give to someone who's listening who you don't necessarily know personally?
Well, it's a good thing about a PhD is that it's not a direct entry program, and so you've got to get steps to get there. So the thing is think about where you'd like to be in the short term. So what is it you're really, really passionate about? You might be about, like myself, you might be really, really passionate about health, but not have a particular area of health that you're passionate about. It might be about engineering or computing. Whatever it is, allow that passion to resonate, embrace that passion. And then once you've had a chance to experience in that undergraduate platform, then you can make decisions around where you want to go from there. So you might think, actually, I don't think research is for me. And so it might not be an appropriate pathway for you. But then you might think, okay, actually, research is for me. And the thing about the PhD, you don't have to necessarily be in a particular area of your expertise. So I could have done a PhD in medicine or engineering, whatever it might be, because it's looking at those transferable skills of a PhD, not so necessarily the content aspect. So I know people who have worked in health moving over into environmental science or genetics. And so I think, don't feel yourself locked in. Live for now, in the moment, and into something you're really passionate about, and then make the decision as those epiphanies happen.
And what about school students who might, they're either trying to think about what they're going to do for the rest of their lives because there's that pressure to do so.
And, of course, making that decision at 17, which is the best time to be doing it.
Yeah, totally. But also maybe those students who are heading into year 11 that need to think about subject choices and with that additional pressure. What do you say to them based on your experience?
I suppose much different, I guess, what career counsellors often say is that, if you're thinking about going to university, think of what type of degree you're thinking about generally. You might not actually know. I mean, we know people kind of will change careers. Most people change careers, change degrees in their life. But at that current point in time, what is it that you really, really would like to pursue? If it is nursing, then think about what are my prerequisites to get into that degree. Most degrees don't have prerequisites anymore. They've often just dropped off of the system.
And you can pick them up in first year if you need.
Absolutely. But think about what are those prerequisites that I need to actually go in there, and we'll make that transition into university a bit easier. But don't necessarily think, okay, I need to do these things now because I'm thinking of 10 years down the track. Think of what you need in the immediate short term. And then while you're doing your degree, think about what are my next steps.
Yeah, because opportunities will arise, new information will come.
Yeah. It's not a decision it doesn't have to be a decision for the rest of your life.
Absolutely, no.
And there's very few people that can actually, are lucky enough to know and make that decision, and that is the right decision for the rest of their lives.
Because I think probably until I was probably mid to late 20s that I realised what I wanted to do. And so, at 17, 18, you don't know what you want to do. You think, I'd like to be working in this area, but until you're actually living and working in that area, you don't really know if it's right for you. So.
Yeah. I was mid-30s, so there you go. I had a very long gap year.
thinking about the myths around PhDs and maybe a little bit of the myths around academia, is there anything that you think people believe that is incorrect about PhDs or academia that you would like to set the record straight on?
There was one thing that my supervisors, the research degree coordinators, all the professors, and everyone in the school would always keep drumming into you. You're doing a PhD. The doors will open once you finish that PhD. I heard that day in, day out. And it got to the point where you started to believe it. You think, okay, once I get my graduation, once I've finished that, I've got my parchment, all these opportunities will arise.
They're going to line up to
They
employ
will.
me.
I'll be headhunted. And it didn't happen. So there's part of because there's part of it was they led you to believe that, but also maybe I wanted to believe it. But I think, on reflection, I think the reality is I think the PhD unlocks doors, but it's through those additional experiences you gain, it gives you the strength to push the doors open. So it's just a step into future opportunities.
Excellent. Okay, well, thank you very much for your time.
Giving your time today, Matthew.
Very
Thank
generous.
you. I think it's really important to hear about these stories from people who are in the field about the realities of your PhD life and your academic life.
Understanding that we don't all sit in a little ivory tower with our houndstooth coats, dusting ourselves off with our thesis.
So was there anything else that you wanted to add or any questions that we didn't ask?
No, that was fantastic. Thank you.
Lovely. Thank you very much.
Thank you.
The very last thing that we should end with is a huge thank you to all of the people who came and gave their time to be interviewed for this podcast series.
Very generous.
It was very generous of them and it was so fascinating. And after every interview, I felt so inspired to be a researcher and to use my PhD. So it was a very eye-opening experience and a really interesting experience.
Yes, and we're really very grateful to every single one of them. But we're also especially grateful to Dr. Sharon Pittman for telling us
gave us the
about the grant.
inside story about the grant.
Yes. She gave us the inside story about the grant that we applied for and we got, which supported the production of this podcast. So thank you to Inspiring South Australia and to Sharon for your very generous support of our podcast.
Thanks for listening to Career Sessions with Dr. Stephanie Champion and Dr. Tamara Agnew. If you like the show and want to know more, check out www.careersessions.com, where you can send us your suggestions for future series and subscribe so you know when a new episode is posted. If you love it, tell all your friends and please leave us a review on iTunes. Thanks to our sponsor, Inspiring South Australia, for their generous support, and to our producer, Rory, at Podbooth. Join us next time when we talk careers with another leader in the field.